Right, I've got a little bit of time on my hands. There seems to be a bit of a sickness bug affecting the patients out there. So I'm going to give you a little bit of history of osteopathy. It's not as dull as it sounds, but osteopathy started about 150 years ago. I think it was the anniversary last year, 150th anniversary. So it's the oldest of the three sort of main manual therapies. So it's older than physio. Physiotherapy started with the First World War, with them trying to fix the soldiers up. Chiropractic came after osteopathy. It was an osteopath with slightly different views who went off and started chiropractic. But then osteopathy it was the first about of those three main manual therapies. The guy who started it, a chap called Andrew Taylor, still in America during the sort of time of the American Civil War. He had four principles of osteopathy, which are still ring true in my head, and I'm reminded of on a daily basis. The most important one, I think, is structure governs function and function governs structure. And you can apply this to whether you're a window cleaner or a ballet dancer or whatever. But the bottom line is if you alter the structure of something, then the function will alter. And equally, if you alter the function of something, the structure will alter. So with that in mind, it kind of makes sense of the changes that we see when we're looking at a body, trying to work out how it's changed, what it's trying to do. Is it trying to help itself, or is it a hindrance to itself? So that's what we're trying to work out. Another principle is the body as a unit. That's quite easy to understand. It's sort of a closed unit, and so the energy you get through eating, ATP and all that kind of stuff, some of it is needed to run your viscera, your organs, some of it your locomotive system, some of it your immune system. So if your immune system is being pounded by something, then it can take it away from other areas and cause effect with that. And that is a very prevalent thing. Another one is the body is its own medicine chest. That's what Andrew Taylor still stated, and it's true. It's got a huge propensity to help itself, and equally, if you abuse it by eating McDonald's and the such, it's going to affect the ability for it to help itself. So you look after your body, and your body will look after you to a greater extent. Obviously, there's modern medicine comes along. I can't remember who said it, but someone on not the 9 o'clock news on Have I Got News for You said, I'd sooner hear an ambulance siren coming towards me rather than wind chimes. And there's quite a lot of truth in that. But there's times when modern medicine misses, it goes wide of the mark. It doesn't, it's sort of looking at the symptoms, not looking at the patient. This sort of new system of chatting to your doctor on the phone is not a great system when you need to be seen. He or she needs to see you walking into the room to see what sort of pain you're in, see the colour of your skin, see whether you're sweating, how much discomfort you're in. All these clues are all part of working out what's wrong with you. And then the final principle of osteopathy is the rule of the artery is supreme. So what that basically means is that healthy circulation is paramount to healthy tissue. And a lot of what we do with the soft tissue massage techniques that we use, we do a lot of soft tissue work, is to stimulate circulation to an area, and within your blood you have the nutrients that are needed for healthy tissue. It has your body's own anti-inflammatories, painkillers. Any medication you're putting in your gob will also get to the area more quickly if you have healthy circulation. Okay, so a little bit of a history lesson. There'll be a small exam to see whether you took that in. Cheers.